Kia ora everyone, this is almost everything you'll need to know about the medial and posterior compartments of the thigh. We'll start with the medial compartment. Generally this is called the adductor compartment, but not all of the muscles are adductors. They do share a proximal attachment around the pubic bone here and innervation by the obturator nerve, the nerve of the medial compartment. The first muscle we'll look at is pectineus here, which we've already seen as an anterior compartment muscle, but it's considered a transitional muscle between the two compartments, anterior and medial, because it is supplied by both the femoral and obturator nerve, and functionally it can act as an adductor, moving the thigh towards the midline. However, it's generally considered in the anterior compartment, so we'll remove it. We can see here the muscles that are considered to be the true medial compartment muscles. There are 5 of them. 3 of them are called adductor something, and the other 2 are this short cone-shaped muscle, which is obturator externus, and this very long slender muscle, which is gracilis. Obturator externus is the cousin muscle, if you like, to obturator internus. It comes from the external side of the obturator membrane, which covers the obturator foramen, and extends laterally behind the neck of the femur to the trochanteric fossa posteriorly, which is the same distal attachment as obturator internus, and only a very slight difference in the proximal attachment being on the other side of the obturator membrane. It's also not much of an adductor, more of an external rotator of the thigh, which is the same function as obturator internus and the other short, deep gluteal muscles. However, it's supplied by the obturator nerve, and it's in the medial compartment. Gracilis is attached proximally to the body of the pubic bone. That's the most medial of the adductors, and is attached distally to the proximal tibia, just medial to the tibial tuberosity, which is the same place that sartorius attaches to distally. The other 3 muscles are all true adductors. This most superficial of them is adductor longus. It's attached proximally to the body and part of the superior ramus of the pubis, and extends distally to the linea aspera, about the middle third of the linea aspera, which is behind the femur as we look at it here. This is what we can see of adductor brevis in this image. It is shorter than adductor longus, therefore it's adductor brevis, and it's also just slightly deeper. If we remove adductor longus, we can see adductor brevis here. Its proximal attachment, much the same as adductor longus, the body and inferior ramus of the pubic bone, and its attachment distally is the proximal third of the linea aspera of the femur. If we remove adductor brevis, we can reveal the large extent of the deepest of the adductors, which is adductor magnus. It has several parts. In some people, this most superior part here is separate, as shown here, but in most people, it's blended with the rest of the muscle. And that's the way it's described in your textbook, so not a separate muscle, but you will see this area here sometimes labeled adductor minimus. For our purposes though, we won't do that, so we'll consider this as the main part of the adductor magnus muscle, whose proximal attachment is the ischiopubic ramus, and its distal attachment is an extensive area in the proximal 2/3 of the linea aspera, posterior to or more lateral to the attachments of adductors brevis and longus. The other part of adductor magnus is the part that attaches to the adductor tubercle, and this is the hamstring part. It's functionally not the same as the hamstrings, as we'll see, but its proximal attachment has extended further along the ischiopubic ramus to the point where it's attached to the ischial tuberosity, which is the common site of attachment of the hamstring muscles. The other reason is because this part is supplied by the sciatic nerve, which is the nerve of the posterior compartment or hamstring muscles. So again, a transitional muscle transitioning between the medial compartment and the posterior compartment. Another interesting factoid is that the gap between adductor minimus here, which I vowed never to say again, and the rest of the muscle is repeated periodically through the muscle. There are further small holes in adductor magnus near its attachment to the femur, and these are for transmission of the perforating branches of the deep femoral artery, which is the major artery supplying the thigh muscles. The deep femoral artery is the only major branch of the femoral artery in the thigh. The femoral artery enters the thigh by passing beneath the midpoint of the inguinal ligament, and the deep femoral artery is a very proximal branch here, and it sends branches through these perforations in the adductor magnus that then travel posteriorly around the femur, encircling it, and then coming around again anteriorly to supply the medial, posterior, and anterior compartments of the thigh. So, very important artery, the chief artery of the thigh. The femoral artery carries on more or less as an unbranching tube till it reaches the adductor hiatus, which is the gap between the hamstring part of adductor magnus and its adductor part. And once it reaches the adductor hiatus, it turns and passes behind the femur and changes its name to popliteal artery. We'll look at all of these structures again from a posterior view for clarity. So here we are, and we can see now more easily the hamstring part of adductor magnus, that part that is proximally attached to the ischial tuberosity, and the main part here fanning out from the ischiopubic ramus. You can also appreciate that adductor magnus from the posterior aspect eclipses both adductor longus and brevis, which are in the picture, you just can't see them. Can draw in the perforations for the perforating arteries from the deep femoral and show those branches emerging and circling back around to the front. Deep femoral artery here, let's say, and femoral artery. Clinicians like to change the name of the femoral artery to superficial femoral artery after the deep branch has been given off, but anatomists don't do this. It continues as the femoral artery. It only changes its name here at the lower border of the adductor magnus muscle where it becomes the popliteal artery. For completeness, we'll just mention the obturator externus insertion, which we can now see into the trochanteric fossa here. This on the other side of the obturator membrane, which is shown here, would be the muscle belly of obturator externus. If we then redraw the obturator membrane, we can add in obturator internus just to compare its proximal attachment and its course, which is to spill out from the lesser sciatic foramen here after coming backwards and attaching distally into the trochanteric fossa. So we see that obturator internus and externus encircle the body of the ischium on their way to the trochanteric fossa. We could also draw in for completeness the popliteal vein, becoming the femoral vein, and the sciatic nerve, which emerges from the gluteal region and drops down essentially the back of the thigh. It is superficial from a posterior perspective to adductor magnus, so lies on it, unlike the vessels which are anterior to it. And it divides roughly at the top of the popliteal fossa, we'll discuss later, into its primary components, which are the common fibular nerve here more laterally, and the tibial nerve, which carries on into the middle of the popliteal fossa. Removing these structures and adductor magnus, we can see now adductors longus and brevis. Brevis here shorter and more proximal, and longus here, longus extending more distally. And again, just because it's a complicated situation, we'll draw in the distal attachments of adductor magnus alongside those of its fellow adductors. Gluteus maximus along the gluteal tuberosity here, pectineus, pectineal line, vastus medialis, and lateralis. And we've cunningly left just enough room for a muscle that we haven't encountered yet, which is the short head of biceps femoris, whose proximal attachment is here just below the gluteal tuberosity, sandwiched between the attachments of vastus lateralis and adductor magnus. And we'll see the short head of biceps femoris and the other muscles of the posterior compartment next. And there it is, the posterior compartment, which consists of the three hamstring muscles. Their common site of attachment here, as mentioned, the ischial tuberosity. There are two on the medial side and one on the lateral side, but the one on the lateral side has two heads, so it kind of evens out. The most medial, certainly distally, the one with the most medial distal tendon is semimembranosus. Its proximal attachment, the ischial tuberosity. Its distal attachment, the posterior aspect of the tibia, here just inferior to the medial tibial plateau. This area here. Its proximal attachment is actually the most lateral up here and the most superior, but it winds its way underneath the other two and emerges most medially. Semimembranosus is a large fleshy muscle. The other medial hamstring muscle which sits on it is semitendinosus. It's a thinner muscle with a very elongated cylindrical tendon, which is easily felt on the medial side of the knee, and the tendon extends further distally and attaches, in fact, on the anterior surface of the proximal tibia, just medial to the tibial tuberosity, so the same place that both sartorius and gracilis attach to, and we'll have a look at that in more detail shortly. The third two-headed muscle is biceps femoris. Its long head from the ischial tuberosity, of course. It's also a very fleshy, bulky muscle, similar to semimembranosus, and it attaches distally to the head of the fibula. It's the only muscle with a distal attachment on the fibular bone. All other muscles attached to the fibula are by their proximal attachment. This is its long head. Its short head, as we saw earlier, arises from the distal part of the lateral lip of the linea aspera. If we turn the thigh a little bit externally, you can easily see the short head of the biceps femoris here arising from the linea aspera. And once again, gluteal tuberosity, vastus lateralis. Adductor magnus would be here. Pectineal line, I think, here. The hamstring muscles are all supplied by the sciatic nerve. Interestingly, semimembranosus, semitendinosus, and the long head of biceps femoris are supplied by the tibial division of the nerve, whereas the short head of biceps femoris is supplied by the common fibular division of the sciatic nerve. That's a little interesting. Also noteworthy that the semitendinosus muscle, gracilis, and sartorius all attach to this area just medial to the tibial tuberosity on the proximal tibia here, which we can see a little better from a medial view. And this three-pronged arrangement of these long muscles, one each from the anterior, medial, and posterior compartments, reminded anatomists of a goose's foot. And this common attachment area is called the pes anserinus, pes meaning foot and anserine meaning like a goose. And these long slender muscles arising from the most anterolateral, medial and posterior corners of the base of the thigh act as guy wires to help stabilize the otherwise quite wobbly position of the tibia on the femur, in much the same way that guy ropes, guy wires help stabilize radio masts and tent poles and other unstable erections in engineering terms. As well as the pes anserinus here, if we look at the other distal attachments of the long muscles to the proximal tibia, we see that they too act as stabilizing agents. So the iliotibial tract here, the combined tendon of the tensor fasciolata and gluteus maximus anterolaterally, the tendon of biceps femoris here, posterolaterally, attaching to the head of the fibula, and the tendon of semimembranosus here, along with the quadriceps tendon and patellar ligament centrally, combine to form a ring of stabilizing tendons around the otherwise quite unstable knee joint, the knee joint lacking any sort of bony congruity to help stabilize itself. And this is similar in the way that a garter belt, for example, helps hold up stockings. You'll have to Google your own image of that. I'm afraid I have to draw the line at Chris Hemsworth wetsuit clad arse. On that note, that's just about everything you need to know about the muscles of the medial and posterior thigh. I couldn't find any very good surface anatomy diagrams, even amongst the elitist of athletes. As we see here, even the great Arnold Schwarzenegger's adductors are a rather amorphous area. Instead, perhaps we can simply admire this lovely picture of Suzanne Charney. I hope you found that useful. Remember to consult your textbooks for more detail. Next time we'll cover the femoral triangle and the popliteal fossa. Until then, ka kite.